Hey, I'm Debra. I'm glad to see you today. I hope you're having a fantastic day. As we age, we are constantly fighting to be heard. Isn't that crazy? A lady once said to me during a presentation, she said, "Just because I'm 80 doesn't mean I suddenly became stupid." She felt that others viewed her as stupid simply because of her age. Seniors very often feel powerless. I know this because I ask and they tell me. I think it's disgusting. People in general don't really know how to communicate effectively. But when it comes to having conversations with people who are aging or who have Alzheimer's or dementia and feel like they aren't being listened to, the communication is even worse. As the medical professional, we must strive to uphold their dignity. Have a discussion, not a one-sided opinion. When you're having a dialogue with a person with dementia, it is a conversation, or rather, is it a conversation, or is it your opinion? Think about it. Help them to maintain a sense of control by guiding the conversation in a positive way. Actually tell them that you're listening to them. It really is that easy. But you have to be sincere. Tell them that you hear them and that their voice matters. I know sometimes it's hard. It takes discipline and practice, so don't beat yourself up. But look back and recognize the mistakes and correct them going forward. As a professional in the senior care industry, we need to take pride in listening to our residents and patients. We have to give them their voice back. Today, I'm going to give you 5 tips to improve communication skills that will help you to keep the exchanges with a person with neurodegeneration positive, creating solutions and outcomes rather than negative conversations resulting in arguments and hurt feelings. No one wants that. Medical professionals like nurses and aides and social workers confide in me daily that they argue with their residents and patients, that they try to help, and that they just end up fighting. I will ask them to tell me how the conversation went, and I can almost immediately tell them when the moment of impact was for that resident. Let's avoid those explosive exchanges as much as possible. Yes? Yes. Okay, so let's make sure you're clear. These techniques will help with seniors in general and communication with those with cognitive disabilities. Guaranteed. There are 5 key points to keep in mind when communicating with people of advanced age. Number 1, acknowledge and realize the enormous losses that this person is experiencing. And as I already mentioned to you, seniors most often feel like they are not listened to. They don't feel heard. Make sure you tell them that you will listen to them. Tell them that you want them to be involved in their own decisions and that you care very deeply. Let them know that you are coming from a place of love. Let's face it, the older we get, the more we lose. The losses just keep knocking us down. Friends pass away, we become isolated and lonely. Perhaps our spouse has passed away. We are pressured to move from our home that has provided us with a sense of comfort for decades. We're in pain. We can't do everything we used to do with ease. Every day presents us with new challenges. It's a lot, isn't it? Yeah, it is. So take a moment and think about all that they have lost and really, what do they have to look forward to? Number 2, let it go. If it's not a safety issue or a health issue, just let it go. Don't be so controlling. Don't be so picky. It's not worth getting into a huge blowout over it. If they don't want to put their pajamas on, who cares? They're not going to get sick or die if they stay in their day clothes. Let it go. Remember, seniors feel that they are not in control anymore. Give them back their power. Okay, here comes tip number 3. I know this one seems a little bit obvious, I know, but it's probably the hardest to put into practice. Number 3, Be patient. Just slow the hell down. We're all so busy. There's never enough time. We hurry, hurry, hurry. But when we push our stressed, busy, hurrying work ethics and lifestyles on our patients, it just manifests the problem and it affects our communication with them. It really does. First and foremost, realize that they are on a delay. It takes them much, much, much longer to hear us, focus on us, and to respond to us. Lower the expectations. Lower, lower, lower. Seniors slow down physically, socially, and mentally. So pump the brakes, put the flashers on, and proceed with caution. Give them time to process what is being said. Ask them what they think about it. What is their opinion? Tell them that you're listening. Remember that. Never, ever, ever, please don't ever interrupt them. This drives me crazy. Stop interrupting them. If you're doing that, please recognize it and stop. I see medical professionals do this all the time. They interrupt the residents over and over and over. It sends me into oblivion. And if you do cut them off, just apologize. Let them speak. Let them finish a sentence. How would you feel if every time you started to speak, someone spoke for you or finished your thought for you or cut you off? That's where the anger comes from. It's not them, it's you. Simply ask, how can you help? Rather than telling them you're here to help. Because they're going to come right back with, I don't need your help. Right? I have some great role-playing videos for you on that. Tip number 4, avoid ultimatums. Ultimatums are demanding and threatening. This type of aggressive communication usually doesn't work and will likely backfire. Now, I'm not saying that in a desperate situation or a safety issue, it actually may be a last resort. But for this particular training, we're avoiding ultimatums at all costs. So things like, if you do that, you're going to end up in a nursing home. Or I told you. So pushing limits are not likely to come off as positive. You also must refrain from using the dreaded, I told you so. Ethel, I told you you'd fall if you didn't use your walker. That's not helpful. This just points blame and it solves nothing. Try something like this instead. Is there any particular reason why you weren't using your walker, Ethel? I'd like to help find a solution to prevent another fall and keep you from landing in the hospital. Wow. What a difference, right? Dang! Can you hear the concern in that statement? So, Ethel, how can we help make using the walker easier for you? Do you have any ideas? See how you're including her? See how you're asking her opinion? I can see the light bulb going off above your head. Now, don't forget to comment below for me. I want to hear your thoughts on that. Number 5. Tip number 5. Reassure them. As we age, we slow down, but things around us are happening so fast. In the blink of an eye, our entire life can change and be turned upside down. It's a scary thought. Think about the thought of every trip to the emergency room may result in heading to the next level of care, like a nursing home. That's terrifying. It's a constant battle in the brain, thinking, what's next for me? They may not show it, but they're scared. They're not as confident as they may appear. Here's where you come in. You reassure them. Let them know that they're doing great. Let them keep doing what they can. It's important to maintain independence and a sense of self-worth. Tell them that they're doing a great job. Reassure them that you will do whatever is in your power to support them. Tell them that you want them to be honest about their needs so that you can tackle those things together rather than have it turn into a bigger problem that results in a loss of independence. Let them know that no problem is too big when we work together as a team. Again, they want to be heard. Everyone needs to be validated. Everyone needs to know that they're doing okay. Let them know that you understand that they're doing their best and that you're here for them. Compliment them often. Tell them that you see them as a strong, determined, intelligent person. Create an environment of respect. Let the person know that you have their back. By building their self-confidence, you'll boost their mood, help with motivation, give them a sense of pride, and stimulate their overall well-being. Some simple general assurance can go a very, very, very long way. So there you have it. There are your 5 tips to better, effective communication with seniors. Give them their power back. Improving communication skills is just that. It's a skill, and it takes practice, but you can do it. I know you can, and I'm here to support you. Comment below about your conversations or arguments that have not been working, and I'll give you even more tips. I'm here for you. Head over to answersaboutalz.org to learn about the Certified Master Dementia Strategist course. You take that and you'll have the confidence to ask for a raise. You could train all the other team members. The course is guaranteed, so you have nothing to lose. I hope to see you there. Okay, my friend, I hope you learned a lot today. Keep going. You've got this. And together, we can.